Today we're going to dive deep into skin rejuvenation and prolonged redness. Perhaps you've seen the amazing results of Ellacor, but you've also heard the whispers of prolonged redness. Stay tuned to the end to see why this is my secret weapon to combat prolonged redness. In general, all skin rejuvenation procedures, whether that's CO2, Ellacor, Marquis, they all cause micro-injury with the goal of improving the quality of the skin. Too much of a good thing can cause inflammation and redness. The normal process of wound healing takes 72 hours of inflammation. Redness prolonged is when you don't transition from the inflammatory phase into the normal process of wound healing. Prolonged inflammation can lead to hyperpigmentation and dark spots, particularly in patients that are predisposed to melasma. Managing the inflammation is the key to addressing redness and hyperpigmentation. Predicting which patient is going to have hyperpigmentation and redness is not an open or shut case. In my experience, patients that are predisposed to melasma have a higher chance of having hyperpigmentation and redness. So here's my three-part protocol to prevent redness and hyperpigmentation after Ellacor. Number 1, oral TXA. Number 2 is topical retinoic acid, and number 3 is liquid amnion. First step in the protocol is oral TXA. This is tranexamic acid. This is an older medication that's now found new uses. Particularly, doctors are using it to treat skin disorders such as rosacea and melasma. Oral TXA works by number 1, reducing inflammation, number 2, decreasing melanin production, and number 3, decreasing hyperpigmentation. The first part of the protocol with the oral TXA, we started ahead of time before the procedure to get ahead of the game, and then we continue for a few weeks post-procedure so we can chaperone the wound healing process. The second part of the protocol is liquid amnion. This is done during the procedure. Right after the microcoring is done, I take it essentially as a facial mask and put it right into the microcores. This has been a game changer because I've seen an improvement in my patients' quality of wounds, a decrease in redness, and a decrease in hyperpigmentation. When I look at the two cohorts of patients, the one before I started using amnion and the one after I started using amnion, it's quite distinct. In the early cohort, I definitely had some patients that had redness, that had some hyperpigmentation. It all eventually went away, but it took some time. The second cohort of patients with the liquid amnion, I have not seen any persistent redness, hyperpigmentation. I've seen much faster wound healing. Third part of the process is topical retinoic acid. We typically start this on days 3 to 5. That's when we transition from the aquaphor to the retinoic acid. Why do we use retinoic acid? We use retinoic acid because the literature demonstrates that it reduces hyperpigmentation. I like this protocol because it's advantageous for patients. It decreases their social downtime and improves their overall patient experience.